Homeopathic physician. Today I'll be discussing about asthma. Okay, so what is asthma now? So if you tell what is the definition of asthma, asthma is a chronic lung disease. Okay, where there is an inflammation in the lungs and there is a narrowing of the airways. So this is called as asthma. And what happens it is and how does it cause? Okay, there are main two factors. Okay, one is genetic and second is environmental. When we tell about genetic, yes, it is a familial background. Okay, it comes from the hereditary. Okay, and why? How does it come? Okay, there is a increase in IgG, immunoglobulin E. Okay, so those who have this genetic factor, they have the increase in IgG very easily. So this is called as genetic factor. Second, it's an environmental factor. What happens here? The environment, the surrounding where we are, causes the asthma. Okay, so we will discuss about environmental one by one. Okay, so first comes indoor. Okay, when we talk about indoor, what are the triggers for the asthma in indoor? First is dust, house dust. Okay, so it's not that 1 day dust or the 2 days dust which is accumulated in the house causes asthma. It is the prolonged dust. Okay, the dust which is not cleaned for months together, years together, especially in the books or in the cupboards. These are the main triggers for the asthma. Second, okay, these are the moles, okay, which we can see in the carpet or in the soft furniture. Okay, I have many patients telling that after I brought new furniture, okay, I have asthma. So this is a trigger. Okay, so what can be happening over here? This new furniture could be having a packing of the material which they are allergic to. Okay, so this is again new furniture. Okay, third, okay, we will come about the beddings. Okay, when we talk about the furniture, it will come about the beddings as well. And fourth, gas cooking. Okay, now this is very rarely to see in the city, but in the rural areas, the village areas, still they use the gas. Okay, where they use the fireworks, and that also can trigger the asthma in the indoors. And pets. Okay, many of them now have the habits of having pets in their house, inside their house. Okay, so their pets, okay, their hair or their any dander, okay, that can cause allergic and asthma. Okay, next is outdoor. Outdoor means outside the house. Okay, so here what happens is mainly the vehicles. Okay, the pollution from the vehicles, the industrial waste, okay, the pollution from the industries, okay, the fossil. These are the main reason for outdoor asthma. Okay, it can also include plastic burning in your house outdoors. Okay, and also the firecrackers which recently happened, that also can cause asthma triggers in the people who already have asthma, especially in the genetic. Okay, and the chemical factories as well. The fumes of the factories can cause asthma. This is the outdoor. Third is the seasonal. Okay, so when it is winters, okay, in winters what happens? The weather is very dry. Okay, and this can cause bronchoconstriction and difficulty in wheezing and breathing. Okay, and causes wheeze. So here also pollen, seasonal when we talk, it is also pollen, this dust, okay, from the weeds, that unwanted plants. These pollens also can trigger asthma in both in genetic and in environmental causes as well. Fourth, we talk about asthma drug induced. Okay, now people who are very sensitive, whose IgG is frequently very increased, okay, in their blood, they have very sensitivity to certain drugs, okay, like beta blockers, aspirin, and non-steroidal anti-inflammatory agents. Okay, so I request everyone, every person who has asthma, if they're going for a certain operation, like females when they go for the cesarean, they will be taking the history, but they have to mention before going for operation that I'm asthmatic, I have this allergies. Okay, because that is giving a good history about yourself, because there are few medication which causes bronchoconstructions and asthma, and it can lead to different complications. Okay, and fifth, okay, we talk about infections. Now it can be a bacterial infection, viral infection, or a normal cold and cough, seasonal cold and cough. These also can lead to bronchodilation, not exactly the asthma, but it can cause into the bronchitis, and there could be wheeze. Okay, this is also type of environmental factors, outside factors. Okay, and smoking. Okay, so not only the people who smoke have problem with asthma or triggers, also passive smoking. Passive smoking means the people surrounding who smoke can induce asthma in those person who has already asthmatic attack. Okay, so smokers, active and passive smokers are the triggers for asthma. And I've also seen people like females who are pregnant and smoking. Their children, okay, usually have atopic asthma. That means a genetic asthma tendency is more. So I would request if anyone is pregnant not to smoke. This can cause asthma in your genetics for the further, like in the offspring. And fifth, we come to the odor. Now, when we talk to the odor, it's like strong odor. Okay, sometimes it can be the perfume. Okay, what you or others. Okay, a strong perfume if you are taken or you put on yourself. Okay, can induce asthma. So usually with the asthmatic patient, we tell them to use a very mild deodorant or very mild, easy perfumes. Okay, and also in the cooking area. Okay, when you go and you do and mixy the chilies and all this has a very strong odor. Okay, the any type of our home cooking chilies or turmeric, anything having a strong odor, okay, can cause asthma triggers, continuous cough. Okay, and also okay, this can cause the odor. And now we come about the psychological factor. Psychological factor, what? Excitement. Okay, so sudden excitement also causes triggers for asthma. You can suddenly get breathlessness, okay, or sudden anxiety, sudden something happened. Okay, this also can cause breathlessness and also grief. Okay, crying, continuous crying or stress also causes asthma or the bronchoconstrictions. Okay, causing to various symptoms. Now, I told about you what are the definition and how it's caused. Now, what are the symptoms? What are the clinical features I see or you tell? Okay, the first thing is wheezing. So there is difficulty in breathing. Okay, you have dyspnea. Okay, you can hear the crackling sound. And second is breathlessness. Breathlessness means you are not able to breathe easily. Okay, so you have to take a strain, you have to take a deep breath. Okay, so it's a little difficulty process. And third is cough. So cough can be dry or with sputum. Okay, if it is a sputum, it can be a very thin mucus. Okay, only if there is a bacterial viral infection, then there could be a yellowish greenish sputum as well. But usually it is a very thin mucus in the cough. And then fourth is a chest tightness. Okay, so when there is difficulty in breathing, even you feel so congested. Okay, the chest feels so congested, there is difficulty in breathing. And fifth is the muscular strain. What is muscular strain? So when we breathing, there are the muscles which help in respiration. Okay, but in the people of asthma who are suffering from asthma, since the breathing is impaired, okay, they have to take a strain. The small muscles come into the picture, the chest muscles and the neck muscles. So because of easy and small breathings in small intervals, this gets strained, okay, and they have pain. So they usually complain of back pains. Okay, these are the main 5 symptoms in asthma. Now, and there is one more thing called as severe asthma or the status asthma. Okay, so in this, in a small period, could be in the 5 minutes, they have every minute they have episodes of asthma. This is called as status asthmaticus. Okay, this is very severe form. This needs immediate treatment. Okay, so now we will come to the management, prevention and management. Okay, so what is prevention? So prevention is always better than cure, we tell. So what we can prevent? Now I told genetic you cannot do anything, okay, much, because you are already having the changes in you. And when we talk about the environment, yes, okay, now it is indoors. I told you dust mites, I told you pets, I told you new furniture, mouse. So these are the maintaining cause. So you have to keep your people who have this problem have to keep their surroundings clean. Okay, second we talk about the outdoors. Okay, now if you are in a polluted city and the area where there is industry which doesn't suit you, the fumes doesn't suit you, then if it is possible, you can move on to other places because these act as a maintaining causes. Okay, so this is one thing. And the seasonal, okay, yes, if you have a field around your house, you can cut the unwanted plants. Okay, and if you have an infection see that you have a proper treatment in the initial stage, if it's the viral or bacterial, okay? So that it don't worsen into the dyspnea, wheezing, and asthma or the bronchitis. And odor, yes, okay? Perfumes, you can, as I told, you can avoid the perfumes, okay? And yes, when I talk about the exertion stress, reduce, okay? There is always a ventilation for the stress. So these are the management which you can do by yourself. Now I talk about the treatment. How homeopathic helps in treatment of asthma. So everyone has the question whether permanent cure is there, how we treat. Yes, we treat. I have several cases who are in ease. Okay, they don't have problem. Yes, sometimes because they have that increase in IgG. Okay, there is every time there can be episodes. It's not that you'll have nil episodes. You can have, but the worsening is less. Okay, it's easy for you to do your daily activities. Usually, asthma people, okay, they cannot do their daily activities. They have that hampering of their daily activities because of the breathlessness. They like to sit in one position. Some people sit in one typical position. They feel ease. Okay, so all these things we can prevent. Okay, there is a very beautiful and good treatment. Okay, and I've treated multiple cases, several cases, and they are happy with it. So when I talk about the treatment part, everyone, yes, will take a YouTube and see these are the medicines. Don't self-medicate, because in homeopathic we see everything. What are the cause we see? Yes, and we see the individual also, what triggers it. Okay, and based on that we have the medication. Now I will talk about few. Okay, first we'll talk about the dust allergy. So in dust allergy, usually I'll take 2 to 3 medication. That's it. Okay, arsenicum album. Okay, so arsenicum album is very nice medication for the people who's having dust allergy. Okay, and also pothos. Okay, pothos also is very good medication for the dust allergy. Okay, now we come about the environmental. Yes, now pollution. Okay, so there is a wheeze. So here we can give spongia, we can give anti-tart, we can give carbohydrates depending upon their symptoms. Okay, and once we come for the excitement, stress related. Okay, so here we have argentum nitricum, we have pulsatilla, we have ignitia, depending upon what psychological factors they induce the breathlessness. Okay, I had one recently, had one a kid. Okay, it was she's 2 years old, and she had asthma, treated by multiple doctors, and she came to me in the first. I gave her medication, okay, depending upon her wheeze, and again next day she came, no, it is not helping. Okay, then I asked why it is causing her asthma mainly in the evenings, and the asthma mainly is seen in the evening. The aggravation is in the evenings. Okay, and one peculiar thing what I got was detachment from the father. Father goes for work and then she starts getting the asthma. Okay, so this is like this. There are multiple one symptom. You know what we call as. Okay, so I gave her pulsatilla. Okay, this is because the detachment causing the asthma. Just she came from the here, when she went out, there was complete no wheezing at all. Okay, so these are the few things. There are many things like that, but this was a small girl, because they cannot tell the symptoms. I have to observe. I have to ask the history. So that's what I told. Okay, and there is lobelia, gastric induced breathlessness as well, and in there are mother tinctures also which we use. Okay, these can be a supporting treatment for the main treatment, like blata is there. We have aspidosperma, which increase the oxygen capacity in the lungs. We have ticta pulmonary. We have, in combinations, we have natrum sulph, we have biochemic number 2, we have asthma mix. So there are multiple medication. I will not tell the dosage over here, because you might misguide, and I don't want that to happen. So you can contact me, or you can comment. Anyone wants anything further details about, you can contact me so I can talk about it in detail. Thank you.